Hello, listener, and welcome to the Southern 7 podcast. I'm Shauna Ryan, Community Outreach Coordinator for Southern 7 Health Department and Head Start. The Southern 7 podcast is a service provided by Southern 7 Health Department to help you and your family live better and stay healthy, and is recorded at our central office in Olin, Illinois. Southern 7 serves the lower 7 counties of Illinois with public health clinics and Head Start centers in each of the counties we serve. If you like today's episode, please share it with a friend. And if you haven't done so, make sure to check out our other podcasts on the Southern 7 app, on Spotify, and through our website at southern7.org. Well, can you believe it? You've made it to episode 3 in our Cancer Warriors Walk for Hope podcast series. Or at least, I hope, you listened to the other 2 podcasts. If you haven't, go back to where you picked up this one, make sure you listen to those, and then come back. Or you can just stay with us, whatever works for you. But I truly hope that what you take away from this podcast and the event on October 5th in Metropolis is that healthcare providers in our region care about you, your family, and your cancer survival. I'm not going to say a lot about this episode, except that it is the coming together of those who've worked so hard to make the Cancer Warriors Walk for Hope possible, and to share with you one last time how we are here for you. If you're not able to attend the walk and you're still needing cancer support, we hope you'll tell others so that they can come for you and or benefit from it. And please reach out to any of us at any time. Well, let's get started with episode 3, Many Voices, One Heart.
Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
The second annual Cancer Warriors Walk for Hope is coming October 5th from 10 to 2 at the Dorothy Miller Park in Metropolis, Illinois. Your whole family will enjoy this one-of-a-kind event, complete with games, food, and activities, a tour through a 20-foot inflatable colon, the chance to meet local cancer care providers, and so much more. It all starts with the Warriors dedication ceremony at the Hope Light Lighthouse at 10 a.m., followed by the walk along Memorial Path on the banks of the Ohio River. All proceeds benefit cancer programs in Southern Illinois. For more information, visit Cancer Warriors Walk for Hope on Facebook or call 618-634-2297. Presented in partnership by Hardin County General Hospital, Massac Memorial Hospital, Union County Hospital, Rural Health Incorporated, Community Health and Emergency Services, Southern 7 Health Department, and the Hope Light Foundation. Welcome back to the Southern 7 podcast. I'm Shauna Ryan, and we are continuing our series on this year's Cancer Warriors Walk for Hope. If this is your first podcast in looking at what's going on with us, we invite you to also check out our other 2 podcasts, and we'll have more information about that for you here in just a bit. But we're going to go ahead and get started with our group here today. This promises to be a well-rounded episode for you to get information about what's going on in our region in terms of cancer care, as well as how you can participate and be involved in the Cancer Walk. So before we hop right on into things, I'm just going to kind of go around the computer here and have everybody introduce themselves. And Todd, let's go ahead and start with you.
All right, my name is Todd Carr. I'm the Chief Quality Officer for Hardin County General Hospital and Clinic in Rosiclare, Illinois, which is in southeastern Illinois, a small river town on the Ohio River.
Very good, Todd. Good to have you on board. Sarah.
Hi, I'm Sarah Chavez. I'm here with Siteman Cancer Center in our Community Outreach and Engagement group. I'm part of the Illinois Cancer Partnership as well. I'm part of their prevention subcommittee, so I'm here representing both organizations.
Oh, wonderful. Thank you, Sarah. Catherine?
Hi, my name is Catherine Brown. I'm also here with Siteman Cancer Center. I help out with evaluations and operations on the team. So yeah, I'm just here to support Sarah.
Wonderful. Good. Thank you, Catherine. Rhonda?
Hi, my name is Rhonda Andrews Ray, and I'm the Executive Director for Southern 7 Health Department, and just looking forward to the podcast.
Hey, very good. Thank you, Rhonda. Chase?
I'm Chase Heilman. I'm the Community Outreach Coordinator with Rural Health Incorporated out of Union, Johnson, and Massac counties.
Harry, we'll let you go next.
Hello to everybody on the podcast today. My name is Harry Brockus. I'm the Chief Administrative Officer at Deaconess, Illinois, Union County, located in Anna, Illinois. I've been working here for the past 2.5 years. So glad to be here.
Very good. And Dr. Walters.
I'm Dr. Walters. I work for Massac Memorial Hospital, Critical Access Hospital in Metropolis.
Okay, great. Good to have you all on with us today. We are expecting a couple more people, so as they join in on our call, we'll just go ahead and welcome them in and let them introduce themselves to you. And again, I'm Shauna Ryan. I'm the Community Outreach Coordinator for Southern 7 Health Department. So we are excited about this year's Cancer Warriors Walk for Hope. This will be our second year doing the walk, and there's some opportunities for you that are a little bit different than what we had last year, and we're going to share those with you here in just a little bit. But before we get into the walk, we just wanted to share with you what the plans are, how we all work in our region. For those of you who don't know, other than Siteman Cancer Center, those on this call do cover the lower 7 counties in Illinois. Siteman is a site that we refer patients to for care, and so we consider them a partner. But the others that are on this call are actually physically inside one of the lower 7 counties in Illinois, if not covering all of them. So what we're going to do is just kind of share with you a little bit about the cancer programs in our region and give you some information on how you can get cancer care close to home. And would anybody like to start sharing about their program, what people can expect when they come to your individual facilities?
I would love to start that off. Us at Southern 7 Health Department, we have a couple of cancer prevention or screening programs. One is our FIT program, which stands for fecal immunochemical testing. And it's just a basic stool sample kit that you take home in the privacy of your own home. You can do it, send it in, and then get a result back that will tell you if you have the presence of blood in your stool. So that's one thing that we're doing. And we've got people from all over the state and even other states that are able to request those kits through our form that's online. And we have sent out many, many of those. The other thing that we're doing is kind of a pilot project that we started this past year, and it's for cancer genetic testing. It tells you if you have a pathogenic mutation that could cause cancer, and then you can be more proactive so that you can get screenings earlier and hopefully prevent a cancer. And so we've done several of those this year, probably somewhere close to 100. We've branched out to where 5 other counties are doing it as well, and those are up north, well, more northern than what we are.
Now, Rhonda, on those cancer programs, where can people get information? If they're not able to come to the walk, can they screen with us at any time? What they need,
Yes.
what they need to know?
Sure, they can give us a phone call. The number is 618-634-2297, and you can be routed to either Shauna or to me or somebody that can tell you how to get those kits or get access to information.
And we will be having both the FIT test and the genetic cancer testing available at the Cancer Walk. And we're going to have our Wellness on Wheels van out there to be able to provide the genetic cancer testing. And then we're going to have our big inflatable 20-foot blow-up colon for people to come out and stroll through and get some information on, and they can pick up FIT kits there as well. Okay, very good. Thank you, Rhonda. Todd, let's go to you next.
All right. Again, I'm Todd Carr with Hardin County General Hospital, and our cancer programs really start with our clinic program, as far as with patients in our clinics have screenings available to them, and training or education programs like smoking cessation and things of that nature. Really it's folded in with our acute and long-term disease management that patients receive through our clinic physicians. We also have procedures that we do in the hospital, such as endoscopies and colonoscopies and skin lesions removal and pathology with those. And so there's several screenings that we have available here at the hospital and the clinic. And then, of course, any of those might lead to referrals because we don't have an active oncology program here at the hospital. And so anything that presents itself through these screenings then gets referred out to someone else. All of our screening or all of our referrals have an initial contact with the referral source within 48 hours, and most of them within 24 hours of the physician receiving the results. Really, for ongoing oncology treatments, our facility really provides a supportive role for the oncologist. With our labs and our scanning capabilities, we're able to provide diagnostic testing for the oncologist to where someone might not have to travel out of the region, and we can provide those scans, provide those lab tests here at home, and so they don't have to go as far to get those diagnostic tests done. And then, like I mentioned before, we do some treatments here. We can do boosters and injections here to support the oncologist and what they're doing for the patient and supporting that oncology efforts. For maybe patients that are needing more care than what they are able to provide in the home, we do have a swing bed program here at the hospital where perhaps someone that's receiving ongoing oncology care can come and be seen and stay in the hospital and get more care than what they could provide at the home. And then we also have comfort care available for patients with or without hospice here at the hospital. So I think at various stages in cancer treatment, we have a role here at the hospital, even though we don't have an oncology program.
Wow, that's really impressive that you have all that there at your site, because the average person has to travel about how far when it comes to more advanced care? Where are you generally referring people to?
Well, usually patients have to go at least 60 miles from our facility, from our community, in order to receive care.
So having that close to home is really important for those folks. And they might not know that that's something that you do. Because a lot of times people, when they start going through cancer care, they think, okay, I'm going to have to travel to Nashville or to St. Louis or into Cape Girardeau or wherever. And they do for some things. But it's nice to know that you're providing services there right there close to home where people can take advantage. And you stay in contact with their doctors in the region and help that process.
Let's turn it over to you, Harry.
So what are some cancer screenings that you offer right now through Union County Hospital?
Yeah, probably the most prominent, right, is colonoscopy. So come in and get your colonoscopy. You can have a screening colonoscopy. If you're over the age of 45 at this point in time, it's recommended that you get a colonoscopy. And so that's probably the primary screening that we do. We do have a wound care clinic here as well. And that wound care clinic can look at wounds on your skin, or moles on your skin, things of that nature. We have general surgeons here as well. So we do a lot of excisions and biopsies of the skin. We live in a rural area, a lot of agriculture. A lot of people have been overexposed to sun in their lifetime. And you want to catch that skin cancer early. So when you see that funky mole or something's weird going on, go see your general surgeon, see your primary care doctor, get that referral, have it excised, have it taken a look at. So that's another type of screening that we're able to do here as well.
Okay, great. And, the reason that we're doing the Cancer Walk is not just to talk to people about, what's available for them here at home, but again, to get them started on that preventative care and that early treatment. And because we all look at that and go, okay, it's scary. I don't want to mess with it. What do you say to somebody that's kind of starting that cancer journey as far as the preventative side? Why is that so important? You touched on it just a bit, but elaborate on that just a little bit more.
Yeah, it's really important because it's the difference between being here for your grandchildren and maybe not being here for your grandchildren. I had my first grandchild a couple of years ago, so that's how I look at it now, right? I used to say for my kids, but now I'm like, I've raised my kids, but I want to be there to see that graduation, right? And if we catch cancer early, there's a really good chance that we're going to be able to solve that problem for you through the partnerships. We have some great cancer programs throughout the region, whether it be in St. Louis, Evansville, or other areas. And we need to catch it early so you have the best opportunities to survive. That's really what I would tell them. Prevention is worth a pound of cure, right?
Exactly. We also want to mention that we here at Southern 7 Health Department, as well as our Community Health and Emergency Services, CHESI, partner with Hardin County General to provide free colonoscopies to people that need them through our FIT program. So it's nice to be able to say, okay, yeah, I've got a positive FIT, now what? We are able to partner with Hardin County General to provide that colonoscopy service. So thank you for partnering with us on that. We appreciate it.
We're glad to do it.
Very good. Let's see. Chase, Is there anything else you want to mention with going into the services that are provided with Rural Health?
In regards to cancer, the biggest one we would provide probably, and I know it's been mentioned already, is the genetic cancer testing. And we provide that through Invitae, and that's all 5 of our clinics in Anna, Dongola, Vienna, Goreville, Metropolis. That's probably the biggest one we provide.
Okay, very good. And like the others on this call, you also are able to refer patients and connect with others on this call as well to make sure that your patients are getting what they're needing. Is that correct?
Oh yeah, referrals, networking, the whole work. Yep, we do it all.
Okay, wonderful. Thank you, Chase. Dr. Walters, do you want to speak on behalf of Massac Memorial?
Absolutely. Thank you for having me. I'm Dr. Walters. I am the Chief Medical Officer of Massac Memorial Hospital in Metropolis. I am also the medical director of one of the outpatient clinics here. And similar to what was just spoken a moment ago, it starts as our outpatient world. So patients have to present, and the 2 areas that we see a lot of presentation are either through the outpatient clinics or through the emergency room. So many patients will present in one of those 2 avenues and see care through either the physician or nurse practitioner or physician assistants through here. We talk about cancer screenings. So we use the medical record, Meditech Expanse. We try to make sure that each patient, for whatever age they are, is meeting the USPSTF guidelines. And each patient, each visit, we're looking for these to make sure that there are no gaps in care. Vaccinations. So talking about Southern 7 Health Department, the Gardasil vaccine is another thing that we use the Southern 7 Health Department for. That does protect from 80+% of cervical cancers for ladies. So that is a really important thing, as well as for boys. As of October of 2009, they recommended this for males as well for throat and rectal cancers. So something as simple as a vaccination could be a huge deal when it comes to prevention of cancers later in life. Talking about smoking cessation definitely was one of the things that we address regularly here, as well as previous gentlemen who talked in the moment before. We do participate with the stroll and with the colon. We give talks locally on the WMOK radio station. We give regular presentations through that. Lots of education on each visit. Each visit becomes a new moment, a new encounter, a new, maybe even a nidus for change for every patient, every encounter that we have. So long-term disease management becomes really important. Something as easy as blood pressure, something as simple as a skin rash. We do have the capability of doing biopsies similar to what was mentioned before. We do have a couple Paducah physicians who come over and do some colonoscopies here at the facility, but we don't have any local physicians that are doing colonoscopies themselves. We employ Cologuard for a lot of our patients. And that is similar to what the FIT testing was that was mentioned before by Rhonda. But this does also add some genetic components to that adds some details to the testing. And a positive or negative Cologuard can then determine whether or not we need to get them urgently to a GI or not. Screening is important. Knowing when these things are needed are important. Delay is a very large cause of morbidity and mortality for the patients in our region. Many of us in the Southern 7 realize that there are a lot of patients that may not have resources that bigger towns, bigger cities have. So we are having to have patients travel to St. Louis, Carbondale, and several areas, even though we're very close to Paducah that has large hospitals and specialists. We're limited by state aid, public aid, and the limitations of truly being a border town. Mm-hmm. We also have a swing bed program similar to what was mentioned previously. And this is a way that patients can get care close to home. They love it. They feel that it is more personal. We do have local nursing homes also, which I do see patients there, as do many of the local docs. And trying to follow up with a lot of the chronic issues can be a big deal for a lot of the patients. We have a very strong lab. We have the ability to do mammography. We have the ability to do a lot of the advanced imaging, such as CT scans, MRIs. So partnering with a lot of those specialists, allowing patients to get their needed tests, whether that's diagnostic blood work, whether that's imaging, locally. So they're now not having to travel, as was mentioned previously, several hours to even get a chest x-ray. So some of these things are really important. Additionally, trying to work on some transportation. The hospital has worked on helping patients get to and from their visits. many missed visits, 10+% missed visits, that affects the community as a whole. If patients can't get to the place, that already creates a hardship for them. So I love working for a critical access hospital. I think a lot of people don't realize the power and the strength behind what we do. They don't understand the difference between a critical access and an acute care hospital. But all in all, working as a big part of a team will help everybody in the long run. So having meetings like this, having the cancer walks, having the education outlets, all of these things help the people of this community.
Very much so. And it's just exciting to hear all the things that are taking place there at Massac Memorial. They seem to continue to grow all the time. And just, I want to get with Sarah and Catherine here in just a second. But before we do that, for somebody that may be listening to this and going, wait a minute, they keep talking about travel and they keep talking about people having to go outside and on and on. For somebody that's not familiar with our region, let's kind of put that into perspective for them. And make sure that the people kind of understand what it is we're talking about and why this is important and how we connect up. And because I think that is it's a vital aspect of that. And Don, thank you for joining us. We're going to get to you here in just a second. I'm glad he hopped on. Don Robbins is with Massac Memorial. We're going to have him comment here in just a second. But I'm going to ask Rhonda to do this. Rhonda talks with folks throughout our region almost every day about what we see here in our region in terms of us living in what we all call a health desert. Rhonda, kind of put our region in perspective for somebody that might be new and listening to what's going on here.
I think Shauna loves to hear me say this because I've said it 1,000 times in front of her.
She's just so good about it.
But we live in a region that is 2,003 square miles. It's roughly the size of Delaware. And if you think of Delaware has probably about 1 million different persons that live in that state. And we have about 65,000 here in Southern Illinois. In Southern Illinois, in our region, we have one Walmart, and it's in Anna. So it is a big deal to get to the grocery store. We have 3 hospitals. None of them have obstetrics or gynecology. So it's a very rural region. The largest thing we have here is the Shawnee National Forest. So when Shauna said it is a health desert, it is a health desert. So if you can imagine the state of Delaware having 1 Walmart and 3 McDonald's, that's what we've got down here.
Yeah, so it is very, very rural. So when you're hearing Todd and Dr. Walters and Chase and Don here in just a bit talking about where they have to send their patients to, we're not talking in most cases 20 miles up the road. For a lot of these patients, they're having to drive at least an hour. So, it's important for people to understand that for us to have an event like this is so important for people to be able to come out and get those resources that they need. So, if you're needing a physician, if you're needing to connect up, this is an opportunity for you to come and talk with people locally here at home who understand exactly what you're going through and, are living in it as well. So we want to make sure people realize, that's why this event is so important to our region and getting that information out. We've had a couple of people hop on with us. Don, would you like to introduce yourself and tell us where you're from? I think I already said that once. I already told everybody where you're from, but go ahead. Can you hear us, Don? All right. Well, Don is actually, he is the CEO for Massac Memorial Hospital. We'll have him introduce himself in just a bit. Keisha, you just joined us. Keisha, where are you from?
Hi, I am Keisha Wyndham. I'm also with Siteman Cancer Center's program for the elimination of cancer disparities, where I serve as the Assistant Director for Outreach.
Okay, very good, Keisha. Thank you for joining us. All right, with that in mind, that's a good little segue. Sarah, we're going to have you chime in here. Tell us a little bit about Siteman Cancer Center in terms of your participation in this and why this is so important for people in our region and how you connect with folks in our region.
Yeah, so we are, Catherine, Keisha, and myself, we are all three part of the community outreach and engagement group at Siteman. So our role is really to understand what's happening in the real world and why there are some of these barriers that exist. And, if we put ourselves in the shoes of the patients that we serve, that's our role. And we're also tasked with bringing all of that information back to Siteman so that we can do a better job of partnering with local healthcare systems. If any one of us thought about going to like a healthcare appointment and thinking we have to drive to the Southern Seven to get to that appointment, it would be daunting. And yet we expect folks from the Southern Seven to just hop right in the car and drive to St. Louis. That's not realistic. And it's not necessary when there are fabulous healthcare providers in the Southern Seven. But what we can do is do a better job of supporting everyone. So we do everything from these cancer warrior walks where we can go out and provide education, but also just listen to what the community really wants and what they think would help them, throughout this health journey. Cancer prevention starts ideally before you get into the healthcare system. So we want to meet people where they're at, where they're living their everyday lives, and kind of figure out what are some ways that we can do a better job of supporting people and making healthy choices. But I'm a huge proponent of cancer screenings. My father is a lung cancer survivor thanks to lung cancer screening. I lost all four grandparents to cancer. And, if these same screening tests, and we were part of a rural community, my grandparents all grew up in rural areas. So I know firsthand the reluctance to go to a doctor unless something's fallen off. Like that's how we do it. But I think if we can flip the narrative and start to talk about sort of getting back to the basics and how to keep ourselves healthy and well and just sort of living our best lives, like that's really where I see our role. And I do want to point out, if you don't know where your closest cancer screening facility is, Siteman's been working with a ton of our partners across both Missouri and Illinois to create like a website where we can get all of the information from all of the locations where you can go to get screening nearby. You can just go to getscreenednow.com. And that should let you pull up what's going to be the closest site to your location so that hopefully you don't have to hop in the car and travel every time you need a simple screening test. But we still want to be there in case you need us. We want to make sure that we are sort of a trusted source that, if any of the hospital systems have referrals, we want to work really closely with our partners in the Illinois healthcare systems. But we're a border town too. We're right there on the border. So we do see quite a bit of patients from over on the Illinois side as well.
Very good. Well, thank you, Sarah. And, we here at Southern Seven partner with Sarah and her team at Siteman on several different cancer programs and are looking forward to that. And Catherine, Keisha, is there anything else you would like to add on behalf of Siteman?
Absolutely. We're very excited that with the work that Sarah is doing with the Southern Seven, we're very, very excited about the upcoming community outreach van that will be traveling through our 82 county catchment area. The Southern Seven region also falls within that catchment area. We look forward to providing initial cancer screenings in addition to other health screenings. One of the screenings that we currently do provide here in the St. Louis metro region is the PSA, prostate specific antigen blood test for men who are high risk of prostate cancer. And we're also providing the FIT test, the colon cancer take-home test, where individuals can take a sample of their stool and mail it to our designated laboratories. So as we're building this partnership, we're looking forward to building connections and collaboration so the community van can be present at an event near you.
Oh, that sounds exciting. Oh, wow. Well, let's kind of elaborate on that a little bit, that, what's coming up. What are some cancer programs that do you see coming up at your facility, at your location in the next few years? Is there anything that you're focused on, working on for folks here at home? Any additional screenings or Anything
I know
that you can think of?
at the state level with the Illinois Cancer Partnership, there's been a ton of talk around HPV screening now that we have an FDA approved HPV swab. And, HPV testing is so critical for both men and women, or HPV vaccination for both men and women. The testing so far is available for women because it is a cervical swab. Picture a COVID test, but for your cervix. So it's not as bad as it sounds, but those types of testing, bringing testing closer to home is really going to make it more accessible for folks in rural areas. If you don't have to make a separate appointment to go all the way to a gynecologist's office to get that test done, the advantage is that once you have a negative test and you know that you don't have one of these virulent strains of the virus, you know that you aren't at that sort of high risk for cervical cancer, and your partners aren't at high risk for head and neck cancers, which we're seeing more and more of. But so I would say, that's been really exciting because we really just want to make the ability to get screened easier for folks, doing it closer to home as often as possible. And then also pushing for lung cancer screening, which I know, combining that lung cancer screening with tobacco cessation is going to be really critical for success for patients. And we do see high rates of smoking, especially in rural communities. It's just part of the way of life in many parts of the woods. So, we want to make sure that we can provide sort of that combined resource for folks who are interested in quitting. But even if you are a current smoker, lung cancer screening is still so important to make sure that you keep up with it. Lung cancer does not have to be a bad outcome if you can catch it early.
Well, and you bring up a good point, Sarah. That's one of the reasons why we're doing this effort is to give people opportunity to get that early screening, have that early conversation, because with cancers, if you can catch them early, your chances of surviving them are much, much greater. And we all, if you live and work in the Southern 7 region, we sit in a hot spot for a lot of cancers, not just colorectal cancer. So it's important for us, to let the communities know, to let our listener know that we all work together here. You're seeing us work together right now and making sure that you are getting the cancer care and treatment that you need when it comes to moving forward. So that's what this event is designed to do, is to give you access to the folks on this call in person, as well as to make sure that you're getting the information for down the road. Maybe you're not a cancer patient right now, or you don't have anybody immediately in your family that has cancer. But it is something to get information on, and this is going to be an opportunity to do this. Go ahead.
Piggybacking on what Sarah and Todd had said earlier, a lot of this, as I said before, we're waiting too long. So the clinic model that Todd had mentioned before, we're talking to children with our well visits. Back to school visits are happening right now. Sports physicals are happening now. We are talking to them about sun safety. We're talking to them about safe sex. We're talking to them about STDs. We're talking to them about cancers and things in their future. And so Sarah mentioned about the HPV. Well, a lot of ladies don't know that you can do a lot of that with a simple pap smear. So pap smear plus testing can do a lot of that screening. And you may not need to travel those 2 hours to see a gynecologist when your local family doctor or even internist may be able to do those for you. So education is definitely key, making sure vaccinations are there, talking about sun safety and talking about it as early as we can. And it even starts with the children, talks with the food pyramid. Locally, with marijuana is now becoming a big deal. Well, there's now some evidence that there's increased head and neck cancers from the use of now a new smoked substance. So what does that look like in the future? And education in general is key. And trying to break the cycle is important, and not capturing them once they have the cancer. It's making sure that now we stop it from happening for future generations.
Right. Exactly. Well said. Thank you so much.
Well, what we hope to be able to do in the future is to continue to develop, as Deaconess Illinois, partner with our other sister facilities here in Illinois, which are in Marion and in Mount Vernon, to improve cancer care in the region and offer more services. Because as you know, these days and age, getting into healthcare in America is difficult. Getting a CT scan you can wait 4 or 5 weeks. Getting an MRI can take 6 weeks. So we want to start partnering with everybody around us that has those backlogs. We generally, as a small hospital, can get you in for a CT or an MRI today. And so, if I go to the doctor and he says, Harry, I think maybe you have a tumor and we want to get it checked out. I'd like you to get a CT. I'd like you to get an MRI. I'd like you to get an ultrasound. We can do that today. Other places can't do that. So what we want to do in the future for healthcare and for cancer care in Union County is reach out to people and say, hey, let your doctor know that we understand that they may be in St. Louis, they may be in Carbondale, they may be in Marion, they may be in Evansville, but we can actually get your test done today. And that means you're going to get the result faster. When you get the result faster, we can advance your care faster, right? And we all know in cancer care, we don't want to wait 6 weeks to let my cancer grow while we wait and find out what is really going on, right? We want to know, oh, Harry, that is a tumor. By the way, we're going to get you started on care today, or we're going to get you started on care next week. Because the faster we can start that care, the better the outcomes are.
So let's talk a little bit about the event that's coming up. Again, listener, if you don't know, we are talking about the Cancer Warriors Walk for Hope. We are going to be having it on October 5th from 10 to 2 at the Dorothy Miller Park. And this is just an opportunity for you to come out and get information about cancer care close to home. So with somebody on this call, you can be more than one, would you like to share what you hope guests get from this event?
I think the hope is that we anticipate that individuals are educated and they understand the importance of getting screened, and they're not afraid to ask questions. It's always important for patients and community members to advocate for themselves if they're not sure about particular screenings. I think that's one of the major things that we see when we're out in the community working, is the importance of advocating and making sure that they are encouraged to talk to their primary care or their cancer specialist about the importance of screening and follow-up.
Mm-hmm. Exactly.
Donna,
go ahead, please. Yes.
This is Don. Sorry, I'm having computer difficulties.
That's okay.
Calling on my phone. So I think with the Cancer Walk, just what's happening here on this podcast, I think it's important that folks can go there and see all of these different entities there supporting education around cancer care, pre-testing, things of that nature, trying to catch things before they start showing up on tests and things, I think is the key. Exactly what Dr. Walters was saying, is being proactive with that and educating. But moreover, even all of the health entities that are on this podcast and will be present at the Cancer Walk, I think it's important for the community to see, we're all in this together. We're all wanting people to be taken care of as early as possible, but go where you are comfortable. We're all putting information out into the public about cancer screenings and different things like that. We all know that a lot of folks in Southern Illinois have difficulties traveling from point A to point B. As Sarah said, you can't just jump in a car. Not everybody can just jump in a car and drive 2.5 hours to St. Louis. Or any place else, really. The fact is, go where you are comfortable to go and get the screening and be proactive in your understanding around various forms of cancer. Because the research, the data, Shauna, that you've provided is obvious that our area is much higher than the state and national average in a lot of different cancer forms, if you will, and overall, at least 10% higher for various reasons. So I think that's what I hope that the Cancer Walk can purvey, is that we're all in this together. Go where you're comfortable. Just go get it taken care of.
Yeah, absolutely. I think that, to echo what Don said, that seeing that by being proactive and having these conversations among your family members, it's also information that you can bring back to keep your family healthy. Chase mentioned doing a lot of the genetic testing, and Rhonda too. Though a lot of people don't know what runs in their family. These are awkward conversations sometimes, but sometimes events like this where it's fun, you can go get it like some treats and see your community, spend a fabulous afternoon at the park. It's a chance to have those difficult conversations in sort of a lighter setting, and to also see people who are on the other side of the cancer journey, that they're surviving, they're thriving, to see that it's not so scary. But it starts with opening up those conversations and being willing to go seek out the resources you need to live a healthy life.
Exactly. Thank you, Sarah. Thank you, Dawn. Anyone else have anything else to share about the day?
Cancer is a devastating disease, but it doesn't have to kill as many people as it does. Mm-hmm. That if we all take the time to study ourselves on a regular basis, look for those signs and symptoms. Is there some discoloration on my skin? Am I having headaches too frequently? Mm-hmm. Am I nauseous all the time? What are those signs? Am I losing weight for no known reason? Right? That's a big one.
Yeah.
I want people to understand the signs and symptoms of cancer so they can identify it themselves, but also maybe even identify it in others around them. And say, hey, have you had that checked out? Because I care about you. Mm-hmm. And to be able to speak, I want them to know it's okay to speak up. And not just assume everything's okay, because I think that's where we falter, is we just say, oh, surely there's nothing wrong. No. Let's get it checked out and make sure there's nothing wrong. That's what I want to take away.
I think events like the Cancer Walk and other activities like this is important because oftentimes we assume that people know the resources that are available to them. They know the screenings that are available to them. They know the even the prevention methods that are available to them. We tend to assume people know the information, and the fact is we find out over and over again that people just don't know what is available to them, conveniently, or the old axiom, an ounce of prevention is worth a pound of cure. Like Dr. Walters was saying earlier with screenings and with school starting and seeing kids and starting early with some prevention methods that are available to them. It's so important to get this information out. And if you can get the information out in a fun way, that's even better.
Exactly. And, it's also going to be an opportunity for folks to maybe connect with a provider for the first time. Maybe they don't have a primary care physician for whatever reason. This is an opportunity for them to come and meet some of those folks, maybe start talking and getting to meet a doctor or a nurse or whomever to make sure that they're getting that care that they need. So like we said, this is going to be a well-rounded event. Yes, it's an opportunity for you to come and walk. It is a bit of a fundraiser for our hospitals and our FQHCs, our health department, and for the Hope Light Foundation that serves the southern 7 counties in the state. But, it's really, most importantly, an opportunity for you to come and get information. Again, you might not be a cancer patient right now, but it's a great way to start connecting up. Or maybe you've not had a colonoscopy, maybe a fit kit's where you need to start, what have you. This is just a very light-hearted event for you to come and have fun. We're going to have games, activities, food, bounce house. We're going to have our 20-foot inflatable colon out there for people to come and stroll through and get information. So it's just a good time. We are going to have an opportunity for you to kind of have a little personal, memorial moment, maybe for someone that you love that's passed on or for someone that's going through cancer. So we'll have an opportunity for that as well. But we do want everybody to know, we want you to bring your kids. This is a fun time. Bring the dog. We don't care. This is a good family event, an opportunity for you to meet folks here at home and just to spend a good day with everyone in our community. All the proceeds from the day stay right here at home to help expand our cancer programs with the folks that are on this call and others. But it's just something that we want you to make sure that you have information to. And again, if you do want to participate, either as a vendor, you want to support the event, or you want to come and set up, or you want to walk, you can visit the Cancer Warriors Walk for Hope Facebook page. All the information is right there, or you can go to our Instagram page as well. All right, well, we're going to wrap this up and try to keep it as short. And we're going to give away all of our secrets for the day right now. We want people to come out and have a good time. But before we finish up our podcast, does anyone have any final thoughts to share?
Dr. Walters had a chat question around sunscreen.
Yeah. That's a very good question.
I handed it out to I'm a mom of 6, so I am used to putting sunscreen on people. So I handed out sunscreen to everybody at the last one. So I will be sure to have our sunscreen bottles. You always have it in your purse and your pockets everywhere. But yeah, I think, last year it was a lot of fun just opening up those conversations and seeing people in real life and just kind of, seeing people going out and enjoying the afternoon, going for a nice walk, sort of kickstarting that physical activity and that commitment to prioritizing your health. And it's so fun to see all of our other partners in the region, to see how we all interact with one another and to see how many people are here and put names to faces so that if you do have questions, you know who you can contact.
Exactly. All right. Any other thoughts before we go?
No,
Go ahead, Chase.
I just want to add that it's just really nice that the proceeds from the walk go right back into the community. Because if you come out and really you don't think none of this applies to you or your family, and you do some screenings, but it's not big to you at the moment, you coming out and if you providing any donation or anything of sorts, it goes back to the community. It may help someone down the road get to that referral, help them out with something cancer related. So in a way, you coming out, you taking part, you're just investing back into your community.
Exactly, Chase. Thank you.
So I did drop in the chat that the website that Dr. Chavez had mentioned, getscreenednow.com. That's the page for Siteman Cancer Center. You can go online and you can type in your location and just look at the nearest clinics that you can go and get medical help. Yeah.
Okay. Thank you, Keisha. Appreciate that. Anything? All right.
Excited to see everybody.
Yeah.
Well, hopefully we'll have good weather and a fun time.
Please do so. All right. Well, I want to thank all you guys on the call today. Thank you for your time away from all the busyness that you do. We appreciate it so much. We're looking forward to seeing all of you out there that day. And if you have anything, just let me know. We'll figure it out at some point. But just thanks again. We appreciate all your help in making this possible once again.
Well, thank you for listening to this episode of the Southern 7 podcast. If you'd like more information about this year's Cancer Warriors Walk for Hope, please make sure you check us out on Facebook at the Cancer Warriors Walk for Hope, or you can give us a call here at Southern 7 at 618-634-2297. Again, that's 618-634-2297. And before we leave you, we do want to invite you to check out all of our other Southern 7 podcasts. Again, you can download them on the Southern 7 app or listen to them at southern7.org. You can also check them out on Spotify. From all of us here at Southern 7 Health Department, as well as all of those associated with this year's Cancer Warriors Walk for Hope, we hope you have a wonderful day.
Southern 7 Health Department and Head Start, making a difference in your community, one family at a time.
The second annual Cancer Warriors Walk for Hope is coming October 5th from 10 to 2 at the Dorothy Miller Park in Metropolis, Illinois. Your whole family will enjoy this one-of-a-kind event, complete with games, food, and activities, a tour through a 20-foot inflatable colon, the chance to meet local cancer care providers, and so much more. It all starts with the Warriors dedication ceremony at the Hope Light Lighthouse at 10 a.m., followed by the walk along Memorial Path on the banks of the Ohio River. All proceeds benefit cancer programs in Southern Illinois. For more information, visit Cancer Warriors Walk for Hope on Facebook or call 618-634-2297. Presented in partnership by Hardin County General Hospital, Massac Memorial Hospital, Union County Hospital, Rural Health Incorporated, Community Health and Emergency Services, Southern 7 Health Department, and the Hope Light Foundation.